Greetings, everyone. This is Eric Hong, Executive Director of the Momiji Healthcare Society, speaking to you on June 17, 2020. I would like to begin by acknowledging that some encouraging development is happening as far as COVID coronavirus pandemic is concerned. While the pandemic is still very much in evidence, with many new cases of infection being found through testing, indications are that the spread of the disease seems to be slowing down. Over this past week, the rate of increase in new cases is half that of the previous weeks. That is very significant and a promising sign of the disease spread slowing down. That is consistent at the national, provincial, and Toronto levels. In Ontario, the government is lifting more restrictions on businesses and social activities in many parts of the province, except for the GTA. Unfortunately, while fewer cases of COVID infection has been found overall this week, the number here in Toronto is still quite high. As such, the government is not yet allowing restaurants, hair salons, and many other businesses to reopen in the city just yet. Nevertheless, some are being told to at least plan towards reopening. Until a vaccine and a cure are found for COVID infections, we will have to continue to be vigilant of the infection risk. I have recently read a set of advice given by a microbiologist about keeping safe in this age of the coronavirus. He recommends that we wash our hands as often as possible and use hand sanitizer when washing hands with soap and water is not immediately possible. Avoid touching our eyes, nose, and mouth. Avoid crowds. Maintain a physical distance of 6 feet between us when outside our home, especially in confined areas. He is also recommending that we wear a face mask when we cannot maintain safe physical distance at all times, such as when we are shopping or when we are taking public transit. He also recommends that we wear a face shield and a face mask when safe physical distance is not possible while we are in frequent contact with people. We should be wearing gloves if we are in frequent contact with often touched surfaces like handrails and countertops. When frequent hand washing is not practical and when using public bathrooms and in shopping areas, we should be wearing gloves. We should not leave home if we experience flu-like symptoms or not feeling well in general. He also recommends that when we do go out, we each carry a face mask wrapped in a paper towel and stored in a Ziploc bag when not in use. We should carry with us some Lysol wipes or hand sanitizer to be used when we touch high traffic surfaces, meaning places that many people touch us. We are advised to bring gloves with us if we are in frequent contact with surfaces touched by many people, such as handrails and holding poles in public transit vehicles, and do frequent hand washing as much as possible. He also advises that if we choose to use a credit card, we keep it in a handy spot so that we don't have to search through our purse or wallet when using it for a purchase. These are all good advice, and I agree that we should all take them to heart. At this time, restrictions are also being lifted gradually in Toronto to allow bigger groups of people, meaning up to 5 or 10 people together as long as social distancing can be maintained. We will also be working towards reintroducing some group activities in the Momiji Seniors Active Living Center. Details are being worked out and announcements will be made as soon as possible. Please stay tuned. As we are hopeful that this first wave of the COVID-19 pandemic continues to wind down, we are looking forward to life at Momiji returning to a new normal that offers a good quality of life for all, as well as safety from infection risk. Thank you.